So here's a quick at-home test you could do to see if your QL might be an issue. The QL lives right kind of on the lower part of the rib cage here and in between the upper part of the pelvis. So we'll have the patient kind of just reach up and over and then bend their side over. So notice we're not kind of just bending straight over all as one unit. We're causing the C shape in the spine. If you feel some strain on this part of the back, odds are you have some level of QL tension or even a strain type injury in that area. Okay, so when we see these patients come into our office and we're thinking it's a QL, there's a few things, if you remember from our introduction video, that we have to rule out. Okay, the big one, anytime we're dealing with any sort of spinal injury, is usually a disc injury. So we always want to ask patients like, are you having trouble going from seated to standing, right? This is can be a characteristic of a disc injury, not always, because that could also be painful in like muscle strain type injuries. Do you have pain down the leg, right? Usually if it's pain down the leg, there's something a little bit more involved than just the QL, okay? So assuming all those are negative, the next thing we like to rule out usually is a facet syndrome. So a facet syndrome is a joint in the back of the spine. It's just a joint inflammation, so I'll have the patient come back towards me. Usually if this is positive, I know we're dealing with probably something maybe in addition to a QL injury, right? Maybe a joint injury. That's what we call a Kemp's test, okay? Lastly, what I like to do is I like to just, for a QL, if I think it's QL, I like to just assess the range of motion. So I'll have the patient cross their arms over their chest. Good. And then you could go ahead and bend to the left for me as far as you can. So notice I have my fingers on this muscle here. I'm just feeling to see if it's kind of tight, which hers it actually is pretty tight here on Alyssa. Good. And the specific range of motion that I think you'd feel that pain with a QL is usually bending away from the side of pain. So when she bends, if her right side was the problem side and she was to bend away, usually that's the provocative motion, okay? So once we've established that, okay, we think that there's nothing big and scary going on here, it's probably just muscular fatigue or muscular strain in the quadratus lumborum, there's plenty of different treatment options we can get started with in this specific treatment setting, a conservative care type office. We'll utilize active release techniques or ART, huge in treating muscular or any soft tissue injury really. We'll utilize the chiropractic adjustment just to make sure all those joints in the area are moving properly and not restricted. And lastly, we'll probably send the patient home with a couple exercises that involve pelvic and rib cage disassociation, okay? So follow along in our next videos for a little bit more on treating QL pain.